Next, another and very important class of OHs, oral hypoglycemic agents, is sulfonylureas. Sulfonylureas, and um, uh, this class has several agents. Earlier, acetohexamide, tolbutamide, and chloropropamide were there, but now these days glipizide, gliclazide, or glimepiride are the approved agents which are prescribed by doctors. And the working area, target area of this medicine is pancreas. Pancreas. It helps pancreas to secrete more and more insulin. It helps pancreas to secrete more and more insulin. So it works in the same way as insulin does. And according to the efficiency and effectiveness, it has been given 3 stars, so it's very effective. And the mode of taking is oral. You can take it in the form of oral pills or tablets. So the mode of taking is oral. And can it cause hypoglycemia? So the answer is yes. Just because it works in the same way as insulin does, so it can cause hypoglycemia. So hypoglycemia is the first side effect of this medicine. And effect on weight. So I just want to say that mild weight gain, this medicine can cause a little bit weight gain, but not too much. So this medicine is safe for obese patients also. If we talk about the effect on kidneys, so it is safe for the renal patients, but it as it increases the chances and probability of hypoglycemia, so the doctor will decide that a renal patient can take this medicine or not. If we talk about the people for compromised heart function, so this generally this medicine is safe for heart patients, and the effect and the cost of this therapy is just 100 to 1000 rupees per month. So it's not a very expensive medicine. It is comparatively cheap medicine. The monthly cost of this therapy is rupees 100 to 1000 rupees per month. If we talk about the possible side effects, so since there is a risk of hypoglycemia, so hypoglycemia is the first side effect of this medicine, and sugars can be very low, so a person must be aware of hypoglycemia. uh, since it can cause hypoglycemia, so renal patients and cardiac patients should be more aware with this kind of medicine. Now another is glitazones. Another class of oral hypoglycemic agents are glitazones, and there are only two agents of this class, pioglitazone and rosiglitazone. Rosiglitazone is banned in India. It is not approved in India just because it increases the chances of myocardial infarction. Just because it increases the chances of myocardial infarction, so rosiglitazone is not available in India. Only pioglitazone is available in India, but in United States or some other countries, pioglitazone is also banned. But doctors prescribe pioglitazone in India. If we talk about the site of action, it generally works on adipose tissues. It works on adipose tissues, and it decreases the insulin resistance and increases insulin sensitivity in the body. If we talk about the effectiveness or efficiency of this medicine, it is given 2 stars. It is given 2 stars means it's effective. The mode of taking is oral. You can take it in the form of tablets or oral pills. Another question is, can it cause hypoglycemia? The answer is absolute no. It cannot cause any type of hypoglycemia. Another question is the effect on weight. Effect on weight. So there is a weight gain due to this medicine. So the patients who are slim or who wants to increase weight with diabetes, or who's the patients who have lost their weight due to diabetes, can try this medicine. So weight gain, And the another question is effect on kidneys. So it is safe for renal patients. Effect of effect on heart. So it is safe for heart patients, but should be taken in the guidance of a doctor. It should be taken with the prescription of a doctor only. So a patient of heart failure or compromised heart function should avoid these medicines. The If we talk about the cost of this therapy, it is generally rupees 80 to 100 rupees per month. It's very cheap. It's not expensive medicine. Rupees 80 to 100 per month, so it's a cheap medicine. And what are the possible side effects? So as I have already mentioned, that weight gain. So the obese or the patient who are overweight should not try this medicine. Water retention. It causes water retention in the body. So the patients who have swellings on their legs or on their face should not try this. Bone loss. So the patient who have some I should say some bone loss, or who are in older age, or who have the more chances and more probability for fractures, should not try this medicine. The another class of medicine is inhibitors of intestinal carbohydrate metabolism. Another class of medicine is inhibitors of intestinal carbohydrate metabolism. And in this class, there are agents like acarbose, miglitol, and voglibose. These generally inhibits the carbohydrate metabolism in GI tract. It works on GI tract, and according to the effectiveness and efficiency, it's given 1 star. The mode of taking is obviously oral, and it is just taken with or just before the meals. And if we talk about hypoglycemia, so it does not cause any type of hypoglycemia. If we talk about the weight, these medicines are neutral. Neither they help in weight loss, neither they increases weight. So these are neutral medicines. If we talk about the effect on kidneys, these are safe medicines, can be taken by renal patients. And if we talk about the effect on heart, so it is safe. Cardiac patients can try these medicines. And if we talk about the monthly cost of this therapy, it is very cheaper, rupees 30 to 900 per month. Only rupees 30 to 900 per month. So poor patients, or the patients who have not financial condition, who have weak financial conditions, can go for this therapy. And if we talk about the possible side effects, so flatulence, and the patients who have a problem with their GI tract should not try this medicine. So it creates gastric problems. So the side effects are almost gastric. The last agent of this oral hypoglycemic agent is insulin. We all know what is insulin. So insulin is a natural peptide hormone which is made up by pancreas, by the isolates of Langerhans, beta cells of isolates of Langerhans. So we all know about that. This is the safest medication of diabetes, because it is naturally produced in the body, so it cannot cause any type of side effect in the body except hypoglycemia. Insulin can lower your blood sugar to uh, a certain extent. So it can create hypoglycemia. If we talk about its effectiveness, it's given 7 stars. Means it's very effective. It can control any type of glucose levels. So there is It doesn't matter that whatever your glucose levels are, it can just control your blood glucose. And the mode of taking is just injectable. We all know that insulin is available in the form of injections only. And can it cause hypoglycemia? Another question is that can it cause hypoglycemia? So we all know the answer, yes, it can cause hypoglycemia. It can lower your blood sugar. So we will have to be aware of that. And another question is effect on weight. Effect on weight. So generally generally induces weight gain. So it helps in gaining weight. So it creates weight gain. And effect on kidneys, we all know that insulin is the safest medication. So insulin is safe for kidney patients, renal patients. And what is the effect on heart? So it is safe for cardiac patients. In every disease insulin is prescribed, so it's for cardiac patients. It is safe for the patient who have myocardial infarction or with the compromised heart function. The monthly cost of this therapy, as we know that insulin is not so cheap. There are some brands of insulin which are cheaper, but insulin is not such a cheap therapy. But if today there are many companies which have launched so many types of insulins. So insulin is comparatively cheaper these days, and it can go from about 300 to 3000 per month. The cost of this therapy can go from 300 to 3000. And the possible side effects, so we all know that there is no side effect of insulin except hypoglycemia. So the patients who are taking insulin should be aware of hypoglycemia. It is safe in every medical condition or comorbid condition with diabetes. So even in pregnancy or lactation, patients are given insulin. So the females or women with GDM, gestational diabetes, insulin is prescribed. So insulin is the safest medication. After metformin, insulin is the second line treatment in GDM, gestational diabetes. So guys, today we have just talked about oral hypoglycemic agents and insulin. In the next video, let's try something more. Thank you so much.